celebrating little pumpkins baby showers. And we are very honored that you've decided to spend your evening with us. If you would please give your attention to our co-hosts and our wonderful supporting sponsors, Molina Healthcare. They are going to tell you more about some of the great services that they have to provide and provide you some important tools, resources, and education. So I'm Jen Rowry. I'm here with Healthy Birthday, which is the nonprofit organization that runs the stillbirth prevention program known as Count the Kicks. And so we are excited to have each of you with us. We're excited to have so many amazing vendors. Thank you to the vendors. All of them are over there. Use them as resources. They have lots of services to educate you on, and they're there to serve you. So thank you to the vendors as well. And thank you to the virtual audience. I'm sorry that I'm kind of making eye contact in two places, but we do have a virtual audience as well for those that couldn't be in the room from across the state and elsewhere. So again, thank you to Molina Healthcare for partnering. Come on up, ladies, and introduce yourselves.
Thank you. Good evening, everyone. I'm Nafise Bonye. I'm the Associate Vice President of Growth and Community Engagement here at Molina Healthcare. We are proud to partner with Count the Kicks to help infants get off to a good start. Today, we know that many families are struggling right now to make ends meet, and it's extremely difficult to do so when there are so many basic needs that must be met for a newborn. So parents are choosing to buy less food just to be able to buy diapers, and that is not something we stand by and allow to happen in our communities. Molina is not only committed to connecting with members to quality, to be able to provide quality healthcare, but also helping the communities we serve. And expectant moms need all, and I say all, the support that they can get as they start this new chapter in their life. Congratulations on you all for having beautiful babies. We love our babies. And so this is why this partnership is so important to us. Thank you and welcome.
All right, I wanted to go through a little bit of an agenda, then I'm going to pitch it to Christine. I'm letting my computer figure out how to move slides right now. That's very exciting. I wanted to do a few housekeeping things. First of all, the bathrooms are in that hallway in the back for the in-person audience. And so if you need to get up and move and stretch and be comfortable or get seconds on the snacks and food in the back, you are more than welcome to do that. So in person and virtual audience, we want you to stay moving, stay comfortable, stay healthy while you're learning and empowering yourselves today. We not only have our great partners Molina with us today, but we have Doula 101 and we have Count the Kicks, and we have that's us. We have the perinatal mood and anxiety disorders, many other resources, and you heard it here, prizes. And we will talk more about that. Yeah, prizes. We'll talk more about that here in a minute. So Megan, can you advance the slide on your end because it's not allowing me to on my end? Just a little.
I cannot.
Okay, there
you
we
go.
There we go. So that's
You
what
got
we
it, Jen.
just talked about. There we go. Before we get started, we want to start with prizes. So Mandy, where's my basket? Here we go. Christine, do you want to grab it? And draw for me some prize winners. We do have a couple of amazing baby baskets that were donated from the Windsor Heights here in this community, Windsor Heights Hy-Vee, that are up here. And we're going to give away one of those at this time. And then Angela with the Black Women for Healthy Living, if you want to come up Angela, at this time with your bags, that would be amazing as well. Angela just surprised us. These are additional giveaways. And so we are going to give away 5 bags. So we're going to draw 6 winners. The deal with the prizes is this, one prize, we'll take your name. You win a prize. There's 1 prize per person in the basket. And so, that's how that will be working. So, drum roll, Christine, who wins the Hy-Vee basket?
Dominique.
Yay! Dominique, if you want to come on up. All right, now we have Angela. Thank you, Angela. She is again with the Black Women for Healthy Living, and she has donated 5 bags. So we'll quickly get those drawn.
Anna?
Anna. Woo! Courtney. Courtney, if you're in the room, wonderful. Woo!
I hope I'm not mispronouncing this. Gracia? By chance?
Wonderful, yay. 2 more. Chattel? We're playing a game of telephone, so if I didn't get that right. Awesome. Hang on, virtual participants. There are prizes for you too. Just hang on there. Ashley. Wonderful. Ashley's going to come up and get her prize. While she's doing that, I'm going to go ahead and pass the microphone to Christine, who's going to share more from Molina. Christine?
Height difference. Okay. Hello, everyone. I am going to actually, before I get started, we're going to share a little bit about some of the things that Molina Healthcare offers their members. And I know that there are people from the general public here. So even if you don't have Molina, if you have an insurance company, make sure that you check about your personal healthy rewards and benefits, because those are things that everyone should be taking advantage of. And a lot of people just leave on the table. So I'm going to see. Tamika, are you ready?
I am. Can you all hear me? I think I have to talk loud.
Try again, Tamika.
Can you all hear me now?
We're going to work on it. We're turning up the sound. Just give us a second.
Yeah, sure.
Everybody send good technology vibes. That wasn't great. Okay, go ahead.
Okay. Can you all hear me now?
Yes.
All right, wonderful. Well, I want to welcome everyone to Molina Healthcare and Count the Kicks baby shower. And we're happy that all of you could make it both in person and online. So thank you all for coming out. My name is Tamika Fisher, and I am a supervisor here with Molina Healthcare in our healthcare services department. And part of my role here is to help our link our pregnant members with services. And so we do have a case management program. And so our case management program for our pregnant and members who have given birth is called our Healthy Beginnings program. And so with that, any member can ask for assistance for care management services, and we work with you to help you make those decisions in partnership with you and any other members of your family and your caregivers and providers. And so we have RN care managers, and our RN care managers are going to help our pregnant members with higher needs. Maybe you've experienced some difficulties if it is a new pregnancy, or even if it's a pregnancy, if you've been pregnant before. So our RN care managers are going to have that experience helping you to support you in that way. And then we also have our care managers that can support our pregnant members who have maybe a lower need, maybe have some few health conditions that need to be monitored, but otherwise would be considered at this time a healthy pregnancy. And we want to make sure that it remains that way. And so our care managers are able to help you schedule appointments with providers, check in on you, help you understand and get your medications, work on your care plan, because that's so important, because we want to know how you want this to look and help support you in the best way with that pregnancy and understand. Can you hear me?
I am so sorry, girl. We are having some technical difficulties.
Okay.
But
Should we have another, one of the case managers come up over, or should we just?
Can you hear me, Christine?
Tamika, can you hear me?
I can hear you.
Okay, so we're getting a lot of feedback through the microphone system, so I think we have to cut a little short. I'm so sorry.
Oh, okay.
Christine, can you do this part?
Okay.
Christine,
right.
can you do this part at all?
If you can just,
Do you want me to take my headset off, Christine, or what is it that?
so just the setup, but I guess the feedback isn't too bad at the back. So, if you want to finish up, then we'll be good.
Okay. Okay. um,
Okay.
So we do have our, as I was saying, we have our case managers. We have our RN case managers that help support our members with kind of high risk needs, and then we have our other care managers that can help our members that are that might otherwise have a healthy pregnancy. We also have our community connectors that can help any of our members connect with resources out in the community, like housing resources. They can help connect you to food banks. They can help you sign up or get you connected to sign up for if you were perhaps to lose your Medicaid, help you with resources with the utility bills and transportation. That is a big one. And so there's so many things that we can do in our in our Healthy Beginnings care management program. So if you are interested in that, you can call our member services, or you can always reach out to our care management program directly, and we'll have that link at the end of the PowerPoint.
Thank you so much, Tamika.
Hi, I'm Emily Westplank, and I'm the EPSDT specialist at Molina. Oh, forgot, sorry. So we do have a couple of our case managers and things here. I know it was difficult to hear with Tamika, but we have some of our case managers and community connectors here today. So if anybody has any questions or is needing to sign up for any services, anything like that, please feel free to just contact somebody in a Molina shirt. We have some case managers back there, some community connectors, other folks here. So please feel free to reach out to any of us if you weren't able to hear or if you have any questions, okay? Thank you. And then since this is up on the screen, I'm just going to talk a little bit about what my role is here at Molina. EPSDT stands for Early Periodic Screening, Diagnosis, and Treatment. So my role is to kind of help make sure that the kiddos are getting in for their, make sure that kiddos are getting in for their well-child checkups, their immunizations, and that they're really able to get all the benefits that their insurance is there to provide. So just making sure that you are aware of when those checkups are due, things like that. So if you see on the screen, there's kind of a list of when those standard checkups are: the birth, the 3 to 5 days, 1, 2, 4, 6, 9 months. And you will get plenty of information about that through case management, things like that. You'll also get that information through your healthcare providers. And if you need help with finding a primary care provider for for your babies that you're having, please feel free to reach out to us, our case management team or anybody like that. We are more than happy to help find those providers and make sure that you're well aware of when those checkups are due, when those shots are due, all those healthy behaviors. And we have some excellent healthy rewards for those kiddos once they're born too. With the rewards aren't just for the pregnant mamas, we have lots of rewards for the kiddos too. So we'll talk a little bit about that in our presentation. Thank you.
All right, everyone. So I'm just going to go over some of the value-added services that are specific to Molina's health plan that any pregnant members can take advantage of, or just parents with kiddos. So one of the great things about Molina Healthcare is that you can get health rewards just by doing healthy activities. Things like going to your annual appointment can allow you to get healthy rewards. And so you can use those rewards. You'll get them on a card, and they're able to be used to purchase things like over-the-counter medications, baby items. If you are attending this event as a Molina member, you would get a baby shower reward, for example. So I'm going to go through a couple of the different benefits that we have so that you are aware of them and you can take advantage of them. So we have cards that can cover over-the-counter medications, which I know I feel like they get more expensive every year, so that's always great. Meals after high-risk hospitalization as well, so that counts for pregnant high-risk people. If you should definitely talk to your case manager and find out if you're eligible. You can get up to 2 weeks of meals delivered straight to your door. We also have weight management and smoking cessation services. And I think this transportation one is really great because a lot of people, sure, getting to a doctor appointment is great, but they need to go so many other places. And so you can actually use your transportation benefits to get to places like the grocery store, to a farmer's market, to WIC as well. So that's something definitely to be aware of. And we also have other benefits, including paying for your high school equivalency, also known as the GED to some. And for your kiddos, like Emily was mentioning, we have benefits for kind of sports and recreation programs as well, because it's important that we stay active to stay healthy, right? And for pregnancy specifically, we do give out a reward for going to your earliest prenatal visit. So in that first trimester, so you can get a free car seat through Molina with that reward. And we do these baby showers as well. We have the one today, and we also do virtual ones throughout the year. So if you have friends, make sure they know that it's great to attend these events. We also do offer doula support in Polk County and Black Hawk County. So we are sitting in Polk County right now. And I'll talk a little bit more about that in just a moment. And I want to make sure that anyone who needs it gets this slide, which has our contact information for the rewards and getting in touch with the people that you need to for that. So I'll pause for a second in case anyone wants to take a picture. All right, we're going to keep it moving because we got to stay on time, right? All right. So next, I really want to talk about the doula program that we have available to people in Polk and Blackhawk County. This is May. And May is really focused on helping specifically Black, Indigenous, people of color, individuals with their pregnancies and having those healthy pregnancies. And so they offer things like pregnancy tracking and classes that can further educate you in your pregnancy. And they also offer a lot of other support. So if you're not familiar, doulas are non-medical birth support people. So they're able to do a whole lot of things like help you draw up a birth plan, understand the risks and benefits of all the procedures that are happening while you're pregnant, being able to advocate for yourself. You can feel like the biggest mama bear walking into the labor and delivery unit and then just like not know how to say, hey, doctor, could you explain that a little bit more for me? And a doula is going to be that kind of pushy person that can really help you navigate those tricky situations. Physical and emotional support, of course, support of your partner too, because a doula really wraps around the whole family, which is great. Of course, support through the birth, but also prenatally and postpartum, and breastfeeding support as well. I mentioned they have classes, and we don't just let May handle you as a doula. We're all tied into that as well. So if your doula is saying, hey, my client really needs transportation, but they're not sure how to navigate that, we can coordinate that or help you find additional resources to support you. And here's a QR code to sign up. And again, we have care management at the back that can help anyone sign up if they are interested or get more information. So I'm going to turn it back over to Count the Kicks. Thank you so much.
I wanted to mention, thank you, Christine, thanks, Molina, that we will also be emailing, if you register, we have your email address, we'll send this PowerPoint out to you and the recording that is happening online. So you can always go back and find information and resources within this presentation as well. And why not a game, right? Just, there's no prizes with the game, and I'm gonna just say I'm old and I'm cool, so I failed at this game when I tried it, but I see a lot of young, beautiful, cool people out in the audience and at home in the virtual audience. They're probably gonna be better at the Guess the Bump game. So really just shout it out when I hit the next slide and you see that baby bump. I want you, it's a celebrity bump. I want you to shout out the name of the bump. So let's see how good we can guess. Yeah. Whoa. I told you you're way younger, way cooler. Rihanna, you're right. Bump number 2. You're right. You're right. It is Halle Bieber. Hopefully the virtual guests are also rocking this in the chat. And, ooh. It's not Beyonce. Oh, we've stumped the coolest of the cool. Cardi B. Hand over there. She got it. Awesome. All righty. Well, it is time. It is time for another giveaway. So that is what we're going to do next. And if you need to stretch, remember, you need seconds in the snack category. You're eating for 2. Go for it. I'm going to turn my page here so that I know who is getting that. We're going to draw for that amazing basket from Hy-Vee. So let's go ahead and draw a name. Oh, I get to draw now. All right. Allie. Awesome, Allie. Come on up. It is this basket.
Thank you.
And we had an additional prize, so we're going to draw another prize. Thank you to Delta Dental, one of our vendors, and a great support system for dental health, which is important, by the way, in pregnancy health. So we have a Stanley mug, but inside is an Amazon gift card. And so we're going to draw for that now. We broke the basket here on this side. Okay. Aisha? I got it close, but I didn't get it quite. Tasha, that's awesome. That's amazing. Congratulations. Okay, more prizes to come. We're moving on. This is me. Count the kicks. How many of you raise your hand? Virtual audience, you can chat in your chat. Raise your hand if you've ever heard of Count the Kicks before today. I love that answer, and it's okay if you haven't heard about it because that's what I'm here to teach you about. So I moved Mom Counted. This is about you being in tune with your baby, your body. This is a beautiful time in your life. And we want you to make sure that you know how important it is in the third trimester of pregnancy to monitor your baby's health. So what is Count the Kicks? Count the Kicks is a highly effective, evidence-based stillbirth prevention program. We developed a proven early warning system for moms across the world, actually. And we've saved lives in 36 states and 6 countries. It says 5, but I think it didn't catch the last one. In fact, there's a picture of a sweet baby from the Philippines on our table back there. So we want you to be in tune with your body and baby because it's a way to bond with baby. It's a way to lower your anxiety during pregnancy, but it's also an important indicator of how maybe mom's health or baby's health is doing. So here we go. So why does movement matter? The last time you were sick, I just want you to imagine the last time you really, really didn't feel well, where did you go? You went to your bed or your couch, but you changed how you moved, right? You didn't go about your daily work day. You weren't taking a jog. You didn't feel well. You changed how you moved. The same thing is true of a baby in utero. When there is something maybe that's making them not feel well, or something might be going on with mom's health, that might be the warning sign that they can give to you. That's why it's important for you to know what's happening with you and your baby. And just to be in tune, remember, it's also about bonding. So because movement matters, when should you start counting? So we want, if you're in a high-risk pregnancy or you have a pregnancy with multiples, 26 weeks. That's a couple of weeks before the beginning of the third trimester. So again, high risk or multiples, 26 weeks. If you are not in those categories, the beginning of the third trimester is when ACOG really recommends that moms start regularly tracking fetal movement. Why? Because that's when babies normally start to build that pattern that moms can feel and recognize. We all might feel our babies, that quickening, at different phases in our pregnancy, and that's okay. But once we start to feel it, even before that time, it's okay to kind of note it, right? To kind of think about what you're feeling in your body and how your baby's moving. What counts as a movement? And this is important. Pretty much everything, a kick, a roll, a jab, a poke. Some of you are smiling because you're getting all those things as we speak, and that's so cool, but not hiccups. Hiccups are an involuntary movement. Baby's not actually intentionally doing that. Think about the last time you got the hiccups. None of us love it. And we couldn't control it, right? It's something that, it was a spasm in our diaphragm. So when you think about the hiccups and what that might feel like, think about when you had the hiccups, it's gonna stay in the same place in your belly. It's gonna be that rhythmic, spasmic kind of feeling. It's not gonna be that push, that roll, that jab. And once your baby's had hiccups, you're gonna know what that feels like. My last baby, whoa, she was a hiccup girl. So, all right, counting kicks. We want you to monitor your baby's movement. This is also important. Every day in the third trimester. How do you know when to do that? Think about when your baby's normally active. Are they a night owl? It's like, oh my goodness, I just got into bed and it's 11 o'clock and I'm so tired, and boom, they're wide awake. You find that time when you can slow down, get comfortable, sit, lay, and get in tune with that movement by counting your kicks. So we want you to preferably do it at the same time of day. So if you normally do it as you get up in the morning, because that's when baby's normally active, keep it in the morning. Normally do it in the afternoon when you get off work because baby's normally active, do it then. It doesn't mean that at 8 a.m. every day, if you haven't had your kick counting session, you can't have that. So make sure that you're doing it once a day at a time when your baby normally is moving. Then what you're trying to do is learn that baby's pattern. What is their normal pattern to get to 10 movements? How long does it take your baby to get to 10 movements. My baby, every baby's different. Every baby's different. If you all have children already, you know that they don't all come the same. That happens from the get-go. And so when you are having a conversation with a friend and they're like, I'm counting my kicks, but it takes my baby 25 minutes, say, great, you get more time to rest, relax, bond with baby. 25 minutes is your baby's normal, but your friend's baby, my babies, when I was pregnant, 5. You know, they were maybe less. I was not educated, unfortunately, this didn't exist for me, but I had really, really, really active babies. And so cool, it took you 5 minutes. You can have now what I call a data-informed conversation with your provider. When they ask you about fetal movement, or if you were to say, I'm concerned, they're gonna say why. Now, as an informed mom, whoops, we just lost sound for whatever weird reason. As an informed mom, that's okay. I was a teacher. I got a teacher voice. Sorry, or virtual people. I'll back up from them. What that data will do for you is change the conversation with your provider. So instead of saying, I feel like something's off, I feel like something's different, you now can say, hey, I don't think, I know my baby, I know, not I think, I know my baby's not moving as much because it normally takes my baby 5 minutes to move, you know, or to get to 10 movements. And today it took my baby an hour and 25. And that clinician can take that information and they can say, you're right, your baby's not moving as much. And you can feel confident in yourself whenever, ever you have a concern, speak up. You are not unwanted. You are not stupid. You are not any of those things. This is your baby. This is your body. This is your health. If you have a concern, trust yourself, trust your instincts, trust the data, and speak up if you have a concern. The best news is a lot of times you might get the all clear and now you're reassured. You've checked in with your body and your baby, and the nurses say, I'm proud of you. You're paying attention. You spoke up. Thank you. How can you count your kicks, right? If you haven't now, I'm going to be that weird presenter that distracts you. Pick up your phones and download the free Count the Kicks app, which is available in 21 languages currently. The app is super simple, super user-friendly. In fact, I'm going to tell you about some of the features. You're going to be able to set a daily reminder, right? Because you're busy. You're busy and it's going to pop up on your phone. You're going to go, oh yeah, it's time to count your kicks. It's going to be in the settings, your personal settings. So you can set up a reminder. If you have an Apple, if you have an Android, none of that is a problem because you can count your kicks on Apples and Androids. Apple Watches, iPads. What if your computer, we have a web-based kick counter for that. So this easy tool, which has been downloaded over 600,000 times across 140 plus nations, could be life-saving for you or baby. And so download that app. There's education, there are resources and many other things, including a very, very fun, cool, new, important feature we just added. And it's completely free. The Ask Anna AI feature is there to answer your questions specific to fetal movement. The cool thing about this is it's not grabbing from Google. It's not going out into the whole world and getting misinformation and sharing it with you. It's only drawing from the research and the evidence that has been proven. So you can ask questions to Anna. Folks, Anna's great. The app's great. It's full of resources, but your number one resource is your provider. And so if you have questions and you're not reassured, who are you going to ask? You're going to go to that healthcare provider and ask for that help. And so you can access Anna on all of the tools, the phone, the iPad, the watch, the computer, anywhere that you're counting, you can access it. And so you can also, it changes languages. These are the languages that Ask Anna can answer questions in: English, Spanish, French, Chinese, Russian, Portuguese, and Hindi. So that's a really cool new feature. It's also become more user-friendly, so check it out. It is a resource that I think you will enjoy learning from and getting in tune with your body and baby. We also, within the app, have a really great find help resources. So you can literally go in there in the resources section, you can put your zip code. And if you're looking for free or low cost resources, you can put your zip code in and it's going to pull those up in your area. So if you put 50320 or 50325, it's going to look for food banks or medical providers, dental care, transportation, those social drivers of health, those things that could be barriers to your health and your baby's health. And it's going to allow you to find those resources. So it's a great tool for each of you to have in your pocket. Or help friends locate services. Even outside of pregnancy, you could be using that tool, right? If you don't have mobile technology, if that's a barrier, that's okay. You can use our paper kick counting charts, which are free, downloadable from our Count the Kicks website, www.counttthekicks.org. And you can print those off and you can do with a clock the same thing I just told you. You feel the first movement, you look at what time that happened, and then you count your, every kick, roll, push, jab, but not hiccups. And then you write down what time it stopped. And you'll have like, oh, that was 5 minutes. I'm going to put that on my kick counting chart today. So you'll just have that over time. It might take you 5 to 7 kick counting sessions to kind of get in a flow with your baby and learn that baby's normal. We also have lots of education and information that you can learn about fetal movement and other important pregnancy topics on our social media channels and through our newsletter. So again, I'll send this out, but if you want to get more information regularly, please sign up and do that. I so appreciate your attention. I'm sorry, I literally feel like this virtual audience's eardrums are blown. I think Megan hopefully has lowered the volume. Hopefully you in the back of the room can hear as well. So I would just welcome you to stretch if you need to. Remember, get snacks, and hey, why not have a prize giveaway? So we're going to go ahead and draw. I am super excited to welcome our next vendor, Naya from Body Echo Massage up. Naya has generously donated 2 massage gift certificates, which are over on the table there. So hey, this is a cool one. If I were you, this would be one that I'd want, a massage by a professional like Naya. So thank you for your generosity, Naya. Okay, here we go. Naya's drawn. You can shout the name.
Francine.
Ooh, Francine. Yeah, right here's great. Thank you.
April.
April. Awesome. Thank you, Naya. All right, ladies, think of me when you're getting your massage, all right? Because I'm jealous. All right, I am thrilled to invite up to have the conversation on perinatal mood and anxiety disorders. So please welcome Brittany Haskins to the podium.
Am I shouting?
You're shouting.
I'm shouting?
I guess our microphone has
Oh, I can
decided.
shout, baby. It's
Yeah,
going okay.
Brittany's got it. Brittany's also expecting with the rest of you.
You're like, yeah, me too. Who cares?
There, it's on.
Oh, it's on again. Okay, cool. Hello, everyone. Okay, so my name's Brittany. Originally we were gonna do labor, delivery, newborn care, and your brain, 20 minutes. Boom, that was kind of a lot. I will happily stay after and talk to anyone if you have questions about how babies come out, specifically at a Unity Point Health Des Moines campus or about newborn care, but we are gonna talk mostly about your brain. And also the PSI table is in the back. So if you blew past me and then after the presentation, you realize why it's important, you can come back and grab some resources. So why am I here? I am not a doctor. I'm not a nurse. I am a certified car seat tech. So if you have car seat questions, that Molina benefit of your car seat is A+, you guys. But I was diagnosed with postpartum anxiety at my 6-week follow-up appointment. I had no idea that that was a thing. All I had heard was like, oh, if you want to like really hurt yourself or your baby, you should probably call somebody. So at my appointment, when I was like, yeah, so I don't sleep like at all and I can't eat like at all, they were like, oh, that's not actually super normal. So that kind of led me down this whole path of learning about what PMADS is, what PSI is, and what resources we have for every single person in this room. Why does this matter so much that we're spending time on it today? Because perinatal mood and anxiety disorders are the #1 complication of pregnancy and childbirth. Up to 1 in 5 moms and at least 1 in 10 partners will experience this at some point between pregnancy and up to the first 2 years postpartum. So that's more than hemorrhage. That's more than gestational diabetes. People in this room who are like, it's not going to happen to me. It will happen to you. Welcome. It's a cool club. There's resources. I promise. Why does this happen and why is it so common? So, the day that you give birth, you have as much progesterone in your body as like 100 birth control pills. 3 days after birth, it goes to 0. So this is not your fault. This is truly science absolutely turning on you. Couple that with the big old changes that you're having in your sleep patterns, and it's just adding fuel to a fire that, like, of course, things are not going to be great in your brain. I'm not saying it's all gloom and doom, but it just kind of sets the context for why this is so common. So to break it down, when I say PMAD, this is what I'm talking about. The P is for perinatal. That does mean pregnancy. So this isn't just after the baby comes out. If you're like, oh my God, I know I'm in the thick of it right now. That's okay. We have resources for you. You can talk to your provider. If you need medication, you can get on it when you're pregnant. And if you're already on medication, do not cold turkey yourself off of your SSRIs or anything before talking to your doctor. There's risks and benefits to everything. Do not just be like, well, I got pregnant, so I'm going to stop. Talk to your doctor. The M is for mood, which is depression, psychosis, bipolar disorder, anxiety, includes stuff like panic disorder, OCD, and PTSD. And then disorder means that this is having a significant impact on your life. So all of you and other people who've already had babies in the room can attest, at some point you're going to wake up and check and see if that baby's breathing. That's just like, hi, welcome to parenthood. If you are so concerned about if your baby's breathing or not that you are not sleeping through the night, that's when it's starting to impact your life. So that's when we kind of look into that disorder. So there's a lot of things that you're like, yeah, the first time you drive with your baby in a car seat, you're going to be freaked out. But if you can't get on the interstate anymore and you're missing doctor's appointments, that's when we're moving into that D for disorder. Okay, so here are those stats again. It is the #1 complication of pregnancy, and at least half of cases go undetected. The vast majority never receive any treatment. That's for a variety of reasons: lack of providers, lack of funding, lack of time. Maybe you have to go back to work and you don't have time to seek out a mental health therapist. There's so many reasons. That's why we have free online resources for you. And then all those numbers are pre-COVID, so I just assume everybody has something going on. 80% of maternal deaths in the first year are preventable. Sad trombone noise. The majority of those are overdose or suicide. So this is very real. Partners in the room, I need your ears to perk up at that. You might be like, that's not her at all. This would never happen. A lot of things can change after a baby comes, so I need everyone to just kind of have this in the back of their mind, have your spidey senses up. This is technically an old stat now. Yay, Medicaid does cover a woman up to a year postpartum. But the stat that keeps me up at night is that 1 in 4 moms goes back to work within 2 weeks of giving birth. If you've had a baby, you know what's happening to your body still 2 weeks after giving birth. If you haven't yet, guess what? A lot of stuff is still coming out of you. So if your body's not doing great, you can't imagine what your brain's even doing in those 2 weeks. So we need a lot more support for moms and their mental health. Okay, you do not have to memorize these. I'm going to breeze past some of these, but just know that broken down, this is prevalence by type. The one that a lot of people associate, psychosis. They think of that as postpartum depression because that's what makes the cover of People magazine. That's when the really gnarly going to prison stuff happens. That is the most rare, but if it's still 0.1% of every birth and we birth 5,000 babies at Unity Point, that means we do have moms who experience postpartum psychosis. So just so that you know, this isn't a catch-all, oh, she had the baby blues for 2 years. There's different clinical diagnoses within the population that you can be diagnosed with. And then partners, you're not exempt. At least 1 in 10 partners will experience depression. Up to 18% will experience an anxiety disorder. Adoptive parents, LGBTQ, everyone is affected by a baby coming. Okay. So you have heard of baby blues. It is a thing. That's that big hormonal drop. We can't do much about that. I'm sorry. It's just a weird time. You're going to be like, oh, it's sunny out and I'm crying for 3 hours. That's baby blues. Just hopefully laugh about it, tell your partner, try to get some sleep. But primarily you're still happy. You're still like, yay, I'm a mom. I kind of have this. If it's lasting more than 2 weeks, that's when we know it's not really baby blues anymore, or if it's getting worse. So it's okay if your moods are all over the place, but primarily we are trending upwards. When it becomes a concern is when it gets severe or it's extending past that postpartum time. Try it again. Okay, cool. So this is a super tiny graphic. You can find it online as well, but this just talks about normal. And I don't love normal. So in the next year, when we pre-approve our slides, we're going to take this one out because there's no real normal, but just know that like, a lot of times bonding doesn't happen. That can be a sign of postpartum depression or anxiety. The biggest thing is that we don't hear about this until 6 months, 12 months later. People are so afraid to say anything because they think that their baby's going to get taken away. We are not in the taking babies away business. You're going to get a screener before you leave the hospital that is for your mental health. Someone told me they thought that was a quiz to see if we were going to take their baby away. It's not. We want you to go home with your baby, but we do want you to be truthful. So just know if you're not experiencing this typical adjustment, that is so super okay, very normal for you. We're not talking about ego dystonic and syntonic tonight. We have wonderful therapists in the room who can explain that to you. But just know intrusive thoughts are extremely common. Just because you're having an intrusive thought does not mean that you're going to act on it. That's the biggest one. You're going to have a bunch of weird thoughts when this baby comes out. As long as you recognize that was a weird thought, that's okay. It's when you're like, I should do that. That's bad. And absolutely everyone in this room has some risk factors for PMADs, whether it's genetic predisposition, your mom maybe had really bad postpartum depression, you maybe do terrible when you go off the birth control pill, and then a ton of psychosocial factors. So half of pregnancies are unplanned. That's one right there. Low socioeconomic status. If you've had a history of infertility or loss, or your baby ends up in the NICU, all of that just makes you more prone to having some mental health issues. And then, of course, all the things that are like already going to happen to you because you're having a baby. So you're going to be like, try to sleep well, try to eat. They're not lying to you. You really should try to eat the Greek yogurt instead of the McDonald's. But it's hard, you guys. I know it is. Try to do it for your mental health. Some symptoms, you're overwhelmed, you're mad. Postpartum rage is a thing that, again, nobody's going to talk to you about. You're not going to be like, hey, bestie, just wanted to let you know I'm so mad at my baby. I just kind of want to leave him in the room to cry. But that is a very normal feeling. How we normalize this is by talking about it. So you have to learn that we have these resources, and then you can be like, you know what, this whole mothering thing is just not what I thought it was going to be. It's okay to say that this normal is not the happy picture normal that you thought because you saw somebody on Instagram who had a baby. Basically, just burn Instagram from your phone once you have a baby, but that's up to you. Anxiety. So everyone's like, you're gonna get your baby weight off. So when I literally couldn't eat, people are like, yay. Turns out not great for your breast milk supply or, you know, your body in general. So speak up if you are having huge changes in your appetite. Also, everyone says you're not gonna sleep once you have a baby. So you're like, well, awake. That's normal. When the baby is sleeping, can you sleep? Those are two very different things. So keep that in mind. And then physical symptoms, like you can't catch your breath, you might be really, really shaky, feel numb. Perinatal OCD is kind of like anxiety's twin. So just know that it's not always like the hand washing and stuff that you see like in the media. You can have obsessive thoughts, and then the compulsion is that you can't stop them. Just know no correlation between your freaky thoughts and you actually doing them. Those are two different things. You can absolutely ask for help from your provider on how to figure out the difference. PTSD, sometimes birth just does not go how you hoped it was going to go, or maybe you have unresolved trauma from when you were younger and it does not come out until that baby in the delivery room and they offer you a cervical check and you freak. That is PTSD. The biggest thing is only you get to decide what is your trauma. I can have two separate patients. One has to go back for a C-section and she's like, this is the worst thing that ever happened to me. It takes years of therapy. And the other one's like, yeah, it saved my baby. I'm kind of cool with the C-section. They had similar experiences, but they interpreted it very differently. So it's only up to you if you have trauma from either birth, pregnancy, previous loss. And then this one, again, nobody wants to talk about it because it's the rare one, but it's the scary one. So if you are fully in Delulu land, we don't need sleep, we are mania, your baby is the devil, please tell someone. You are not going to get your baby taken away forever. You might be separated for a little bit for a hospitalization, but that is not a forever thing. There are medications. Postpartum psychosis is a medical emergency. This is not, oh, let me call up Bloom and get on a waiting list. Psychosis is, I need to go to Broadlands Crisis Observation Center or call 911, but we need immediate help. Again, 1 in 2 women, but it is the big scary one due to the suicide and infanticide rate. So what are you supposed to do? You gotta tell somebody. We're not mind readers. Whether it's you experience it or you see it in your partners, maybe like finesse how you bring this up to her. Don't be like, wow, you seem rageful today. But be like, this whole mothering thing isn't really going maybe like we thought it was gonna go. Should we talk about it? Communicate expectations with other caregivers in the home. That includes other generations. A lot of this was not talked about before we started talking about it. So if you have grandparents who are helping out, you might have to be like, hi, I have to go to a doctor's appointment for my SSRI because I was diagnosed with postpartum anxiety. My mother's face, it was so great when I told her that. But you have to tell her that she doesn't know that that's going on. And then be very gentle with yourself. As long as you are mentally well taken care of, your baby is physically well taken care of, that's pretty much bare minimum for a postpartum period. Someone else can vacuum your home. Self-help, go get yourself a massage. These are all like very glib. And once you have a baby, you're going to be like, I don't have time for any of these things. But still, they do help. Again, since this is not in just that first postpartum period, it could be 6 weeks, 6 months, 8 months, a whole year after you have the baby. Try to work some of these in. Finally, the most important part is resources. So for you guys, we send everyone postpartum.net. Everything is free there for you, whether it's online support groups, getting matched with a mentor. Cannot recommend them more. And then if you need to find someone, we have a directory. So you can look up therapists who are taking patients. If you need help in a crisis, Broadlands Crisis Obs, Unity Points Behavioral Health, Urgent Care, the suicide prevention line, maybe you can offer to sit with a friend. If they're like, I'm having these thoughts, please do not leave a suicidal person alone. Say, I will sit with you while we dial 988. And then Psychology Today also keeps up to date on like what insurances and what therapists are taking people. Next steps clearly is an old slide because we did further that expansion. But go to postpartum.net. You have to talk about it. If you've experienced this in a previous pregnancy, feel free to share your story, whether it's to a friend, to a partner online, but we need to start talking about it to reduce the stigma. Here I have a bunch of, that's my personal cell phone number. That's wacky. You can use it if you want to. It's fine. Everyone in town has it. You can email me either at work or at the PSI chapter. I do the tours and car seat appointments for Unity Point. So that top one is relevant. What I do want to tell you about that is that birth does not last forever. Whether you are in a hospital, whether you are giving birth at home, however your baby comes out, you will not be in labor for the rest of your life. But hopefully you are a parent for the rest of your life. So I want you to take as much time as you spend writing your birth plan and 10x it to make a postpartum plan. Think about the things that your body needs. Example, has anyone told you you'll be bleeding for 6 to 8 weeks? You need pads, you need Depends. If you live in a 1-bathroom home, do you have a trash can near the toilet? Because if your mother-in-law comes over and you're like, my postpartum stuff's just out in the bathroom. We need to be thinking about these things. They are far more relevant. Not saying birth is irrelevant, but there's a lot more happening that we need to think about once you get home and there's no nurses, no midwives, no doctors to be helping you. So with that, I will stop screaming at you and I will be over there to answer literally any questions that you have until I fall asleep.
Obviously, Brittany is a wealth of information and has a great sense of humor as well. So thank you, Brittany, for also she's expecting, and we made her shout at all of you for, so she's gonna drink some water and rest a little bit here. Hey, we have more prizes, so we are gonna go ahead. We would love to invite Brittany from Sweet Pea Doula up because she is giving away a cute, adorable, precious baby basket. So Brittany, thank you so much. And let's draw a name. Digging deep. Taylor. Taylor. Awesome. So very quickly on the screen, I'm not going to spend a lot of time because we promised to be done at 7 o'clock. But what you can see tonight, if you haven't figured out, is all about resources. The good news is there are lots of great resources. You just maybe haven't been told about them. So that's why we're here tonight to tell you about them. On the screen, you see that you can get connected and get help by dialing on your phone 211, and you can see resources in your own community, much like the Find Help, which is below that. That Find Help is the one I said is in the Count the Kicks app. It's embedded right into that app, and you can access resources that free or low cost resources there. Safe Kids Worldwide will give you a lot of car seat safety information. Talking about after birth, right? This is a part of the plan. They don't let you leave a hospital without that car seat and the safety checks and all of the things. So make sure you're thinking about that. For our community that is worried about trusting their providers, our BIPOC community, especially, the Earth app is a great resource. It provides you the opportunity to see reviews that other members of communities have given to about providers, whether it's your, prenatal care, whether it's your postpartum provider, pediatricians, whatnot. And so that is an app you can download and like read real life reviews and experiences by others. So the Earth app is another resource. Finally, HRSA has the National Maternal Mental Health Hotline, and this goes along. We have resources and we have great care providers and hospital systems here in our state, but this is another great resource. You can dial anytime you need it. So maybe you're having questions, or as a partner, you can dial it and say, I have questions about how to support and should I be concerned, that type of thing. Please call or text that hotline for support anytime. We also want to give a big thank you to First Candle. So those adorable swaddles that you all picked up on the back table were donated. So thank you to First Candle for that. Hopefully you've already downloaded it, but if not, I would be so honored, and I think you would be so blessed to download the free Count the Kicks app. Get in tune with your body, get in tune with your baby, bond with your baby. That touch point's going to lower that anxiety when you're worried. That'll be like, oh, they're moving really well. I know they're in their normal. I feel good about that. Oh, they're not moving the same. Now I've got that data in my hand. I'm going to speak up. I'm going to go to my provider and I'm going to get checked out. And that's okay. And a good doctor and a good nurse who are standing here would say, we want to hear from you. We would rather hear from you than you stay home and be worried all weekend and have a very negative outcome. More prizes, because that's what we're all about tonight, is also spoiling all of you. So even if you've won a prize, I'm gonna give a little surprise to the in-person people here as well. I have three $25 Amazon gift cards and a pack and play that we're going to draw for in the room. But if you're listening online, Megan will be doing a drawing online for the online participants, and they will receive also 2 Amazon gift cards and a pack and play for the online or virtual audience. And if you're a winner online, Megan wants you to know that you will receive an email directly from her in the coming days. So you will be notified if you're an online participant. But for those in the room, let's do this now. Let's draw some names. Robita. Awesome. You bet. Thank you. Okay. Another Amazon gift card here. Piper. Thank you. Jezebel. Awesome, thank you. All right, and now for the pack and play. Okay. Michaela. Michaela's not in the bathroom, right? Michaela, all right. Adriana. Awesome. You can let your husband laugh. You don't have to- Awesome. Okay, well, we also have, for those of you that are in the room, there are items still back there. We did not hand out all the wipes and the diapers. I promise you're gonna need them. I had 3 kids, you know, you're gonna need them. So please, take those, grab another bag, thing of wipes and another bag of diapers, before you leave. And we cannot leave without thanking each of you for giving your time. And Molina Healthcare, high five those Molina people. Thank you so much. Online, we appreciate you so much, and this concludes our presentation.